Welcome to the office.
Hi!
Hi.
Happy New Year.
Happy New Year.
How's it going, Jess?
It's going good. How are you?
I'm good.
Good.
So we're recapping a little bit.
Okay.
You've been here for how many months?
Was it June? Maybe?
It's
Somewhere
been about
there.
6-7 months.
Yeah.
But am I seeing you 2-3 times a week every week for the rest of for these 6
No.
months? No.
No.
Let's talk about what happened. Why'd you come?
I was having unexplained burning in my thighs, and I've seen every doctor you could think of. Went through different, not surgical procedures, but different procedures. No one could figure it out. Nothing was working.
So when you say burning in the thighs, it started, how long ago was it?
It started around 2018.
And we're in 2022.
Yes.
Happy New Year.
Yeah. So I just kind of
Was there a cause?
we figured out there was a cause,
No,
but
I'm
I
saying
didn't know there was a
before
cause.
coming here, what were you told? Like it just suddenly came up. You woke up one morning and your thighs were burning.
I was starting to work out, and it got to the point where I couldn't really use my legs. My muscles would cramp up,
Okay.
and they would burn to the point where I have to like stop, shake them out, and I couldn't really use them.
Okay.
I just started to think I was getting weak, and something was wrong. Nothing was really wrong, and then I started seeing doctors. They said I had an autoimmune disease where the muscle gets attacked, and then I did infusions for it. Nothing helped.
Infusions. What do you mean by infusions?
IVIG infusions.
Okay.
So
Did any of
immunoglobulin.
that help?
No.
Okay. And so there was no autoimmune.
There was no autoimmune. So
Okay.
there was only one marker that showed that I was a little high, and they said, well, you're having these symptoms. This could be it. So that's what you have. They did 3 rounds of infusions and nothing worked. They wanted me to go see a muscle specialist to get a biopsy of my muscle and my quad. And before I did that, my mom begged me. She said, please go see Dr. Rahim. Just get a second opinion, see what you can do. And it's corny, but it is like, you've changed my life. So thank you.
You're welcome. But mom had to force you to come.
She did.
She did, right?
She did.
Because what you thought, what is a chiropractor going to do?
I did.
I'm sure you did.
I had spinal MRIs, I had brain MRIs, I had everything, and everything looked fine, and they did x-rays, and nothing seemed wrong, so.
Okay. And here's the thing, when we're looking at x-rays, MRIs, CTs, advanced imaging, they're looking for a thing, right? They're looking for a thing. They're looking for, is there a growth? Is there something broken? But that wasn't the case.
Mm-mm.
And what did we find?
We found that I had some old tailbone injuries that had caused the problem.
Okay. And so which was causing some nerve pressure.
Correct.
And people ask, like, what am I doing here? That's what I wanted to share. And kind of, am I treating burning thighs?
No.
No, what I'm looking for is the cause, right? And what does that mean? What do I mean by I'm looking for the cause? Because my philosophy is very simple, that the body is designed to be in balance with nature, and the brain controls every single function in the body, either directly or indirectly. And how does it do that? It does it through the nervous system. We have a spinal column. Can I just go over the spinal column?
Yes, of course.
So let me grab this spine, and this is really important. And that the spine, we all have this, right? We all have it. We're all we're standing up, we're biped, and we have this amazing structure. It's called the spinal column. It has 2 functions, just 2. To house and protect the nervous system, the spinal cord. We have a bony casing that protects the brain, right? That's the skull. And what happens? We have the brainstem, which exits out the skull. We have the nerves that go down, the spinal cord goes down, and then we have the nerves that exit out at all these different levels. There are 24 movable bones, 33 pairs of spinal nerves. And the idea here and what we're doing is we're looking, is there any obstruction between the brain and those nerves? And how does that happen? It happens from misalignment, trauma. Trauma initiates the misalignment. And then what we get is we get inflammation. Inflammation protects that joint. And if left unresolved, what happens? We get some decay or degeneration or immobility. We get muscle tightness, we get spasms, we get all these different symptoms. And then let's go a little bit deeper for a second. You want to know this?
I do.
Okay.
Yeah.
We have these nerves that exit out. So we have in our neck, we have 7 bones called cervicals,
Right.
12 in the mid-back called thoracics. I say T1 through T12. 5 in the low back called lumbars.
Mm-hmm.
And then we have the sacrum, which are 5 segments that ossify or mature by around 32 to 34. Okay, let's take a nerve root. If we take a cross-section of this nerve root, we have thousands of tracts or fibers in there. And one misalignment or pinched nerve or irritated nerve or herniated disc, which we'll get to later on, can cause many different symptoms. Okay? In your case, we found what? We found an old tailbone injury, and we have these sacral nerves that come out. And one of those nerves, or in connection with the others, was causing your symptom.
Right.
And your symptom was?
Burning thighs.
Burning thighs, right? So we're not treating the symptom. I said, what did I say in the beginning? Let's see what happens.
Right.
Right? I didn't promise
No.
anything. I said, if there's irritation to the nerve that's causing the symptom, and if we can find that, then maybe there's going to be a physiological change.
Right.
And there was.
There was.
And that was kind of cool.
It was.
It was really cool.
It was really cool.
Yeah. So now what we're doing is we're doing a checkup.
Yeah.
You come in for some maintenance.
Mm-hmm.
And it's been, what, about a month?
About a month. Yeah.
About a month.
About a month.
Okay. And so why don't we see what's going on? Do you have any questions in this?
No,
Okay.
I don't.
Shall we get started?
We shall.
Let's do it. Starting at the base of the neck. So, what are the components of this exam? Component number 1 is instrumentation. Actually, component number 1 is history taking and getting a case history of what happened. And through the history, we usually get clues as to what's going on. Now, starting at the base, I'm getting pressure, 10 points around T3, T4, left side. How have your workouts been?
They've been good. They've been really good.
Awesome. Are you increasing your strength?
I am. It's been a journey, but it's been cool to see.
So in the last 6 or 7 months, how can you quantify your strength increase?
Oh, it's probably gone up about 50%.
What?
Yeah.
What?
I know. I wasn't even able to do push-ups for a while. I had so much pain. And just weakness. Just straight up weakness.
And what did Mama say after all this? I told you.
Pretty much.
Yeah, I told you.
Words.
I told you. What did hubby say after all this?
He is beyond grateful.
Good. Left side. 7, 8 points. T4. Let's check the neck. How's your push-ups have been good? Your upper body has been good in terms
upper body's been good. My left shoulder, I don't know if it's just a muscular imbalance, but I have, I don't know, something's weird when I try to do push movements or lat movements.
You mean shoulder presses or lat pull downs?
Correct. Something in the shoulder girdle doesn't seem to connect.
Left side.
Left side.
Can we watch this, please?
Yeah. So when I pull down, I don't actually feel the muscles.
You don't feel you're activating the lats here?
No, not on my left side. I have just tension and kind of pain in the shoulder.
And do you see where she's pointing to right here? That's around where we're getting that nerve pressure. Now, just do a few lat pull downs. Pull down. Watch. Keep going. You see how the right one comes down all the way? The left one doesn't. The left one actually goes in. The right one comes down. The right one goes up more. The right one comes down more. So something's stuck here.
Something's stuck. I was trying to do a pull-up the other day and I couldn't get past the...
You can also see it's slightly swollen here than it is here on the left side, on the left upper trap, here versus here. Now, do shoulder presses. Start in the bottom position. Watch. Go ahead and push up and down. Up and down. Slowly and down. The left one is not engaging. Correct. Okay. So we'll test that afterwards, okay? Feet together, scoot forward please. Let's check the movement in the pelvis. Open and close the knees with your knees touch, your feet touching. Open and close. Open wide and close. Open, close. Right side only. When she does the right side, the left wants to go with it. Do the left side. When she does the left side, the right is independent, but there's more muscle guarding or fixation up in here that's causing it. Scoot back for me, please. Let's check tailbone, make sure we're good there. Back slowly towards me. L5, S1, S2, S3, tender.
Not in the finger, right below, right in the middle of the abdomen.
So more of a stretch in the front?
Yeah, but not a good stretch.
Okay. I think that's coming from your T4 area now. Top of the joint. Let's motion the SI joint. Top of the joint. Middle of the joint. Bottom of the joint. And top. Middle. So it's not moving as well in the middle.
I'm starting to get the kind of the burning
When I do that?
when you do that, and
Where?
it kind of goes down the down the tailbone,
Okay.
and a little bit on the left side.
Interesting.
Yeah,
So a very similar symptom,
very much so.
but a completely different cause.
Right.
Okay, bottom of the joint. Are you getting it right now?
Yeah,
More when I push at the bottom, more when I push in the middle.
in the middle.
Okay. 6, 5, 4.
Oh,
Ooh, 4, 3, 2.
all the above.
Hey. Now what's interesting is we were getting it up top a little higher, but C4 is the culprit. And it looks like that was the one we worked on a while back, right? We did.
I think so.
Yes, ma'am. So scoot forward, please. C4. Let's do static palpation and watch the spine, please. Starting here at the base. And as we run the fingers down the spine, you can see right there. She kind of has some dishing going on here. Mm-hmm. I think you overdid it a little bit in the gym, yo. Because look, the swelling is here, but it's going down all the way. Keeps going. Gets even more puffy here all the way into left SI joint. Head down, please. 6. 1, 2, 3. 1, 2, 3, 4, 5. 4. 5 is also tender though. 4 is sharper.
Yeah.
If I put my finger right here on this left side, I'm going to put a little, you can lean into it just a tiny bit. That's too much, just a little. And go ahead and do your shoulder presses. Different or the same?
About the same.
Okay, let's go down. Okay, and let's go up. None of this is moving yet. Okay.
And something's clicking.
Something is clicking. Let's do C4.
Okay.
T4.
Okay.
And left pelvis.
Okay.
You know what?
What?
I'm not doing that. I'm not buying that. And I'll tell you why. It's T5. T5 was tender, T4 was sharper, I understand. But when I'm going to the film, T5 looks a little bit. 1, 2, 3, 4, 5, 6. 6 and 7 look about the same. things start to shift at 5, and then 4 shifts more with it, 3 shifts more with it, and we have a little bit of that slight little kink. And that's part of the imbalance of the shoulder. So to fix that imbalance, we actually have to go to 5. So what I'm going to do is I'm going to change my approach for a second. And we're going to do the left pelvis. We're going to do T5, and then I'm going to recheck everything.
Okay.
Sound good?
Sounds good.
Okay, let's go right side down. Let me put some paper there for you. SI joint, 2 inches lateral. 3 inches inferior, tender.
A little bit.
Little bit.
A little bit.
Little bit. Shh. Does that cause burning when I do that?
No.
Okay. Nice and easy. We're going down and out. Why? Gotcha. Very nice.
Very nice.
Stand up, please. Let's walk it off once this way.
Okay.
And then we'll go on the high-low table. Let's go over here. PR-T. 1, 2, 3. That's 5.
That's 5.
That's 5. Get all the tissue out of the way. We're going to be right on the transverse. And we want to set it right through. Just like that. Let's walk it off this way, please. And you were saying about your foot?
Oh, when it's dealing with my pelvis, but when I stand, like when I go to prepare for a squat and I stand, I notice that my right foot is extremely staggered, and I can't bring that left foot up because it just this is how, it just stands like this, because otherwise I twist.
Go ahead and let's see that. Let's even them up first. Okay. Do a squat. Is that a little different?
It's a little different than yesterday, yes.
Keep going.
But I have a little bit of tension in here, and it's kind of going down that way. And it kind of comes in there, around the knee.
Okay, come back over here, have a seat. Let's recheck everything. Starting at the base. 5 is clear. We're going to have to go to the sacrum.
Okay.
As much as I don't want to do it on the same visit, I'm going to have to do it because that's what the body's telling me. C4 is a compensation. We're not touching compensations. Let's do your sacrum on the slide up a little bit, please. There we go. Hi.
Oh.
Oi. 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 Poquito. Gotcha. That was it. Check the ribs now.
Oh.
Ooh.
I'm sorry.
That's okay. That's T3 rib. Deep breath in, blow it out fast. Deep breath in, blow it out fast. That's it. Got it. Had to work for that home run today, yo.
Yeah.
Okay.
You and me both.
That actually looks a little different. Okay, let's try squat.
Well, it feels different. Feels better.
Your knee's not catching.
Mm-mm. No, it's not.
Have a seat, please. And let's recheck the neck.
Okay.
And before that, I do that, just humor me and do a shoulder press. Qué bueno.
Qué bueno.
Diferente.
Sí.
Up and down. Up and down. It is different. Up
It's different.
and down. Muy bueno. Huh.
Was that a rib?
T3 rib on the left.
T3 rib.
T5 vertebrae, T3 rib. Clear.
Can I ask you a question?
Please.
Is the T3 rib is connected to the T3, I'm assuming.
Correct.
So if a T3 rib is out, why isn't the T3 vertebrae out?
That's a very good question. Because T5 was out, T3 is probably compensating the twist. And the compensation of the T3 twist is probably what threw that rib out in one of your workouts. It snagged on that muscle a little bit.
And so
We're clear.
does the lat cover the T3?
The shoulder blades. So we have, I don't have that model, okay? But here's the idea, look. We have our scapula,
Right.
Scapula, which is part of the shoulder girdle.
Right.
And the scapula sits on top of these ribs.
Right.
The scapula has a bursa underneath it. So it's like this. Check it out. These are the ribs, this is the scapula. Okay? So this is your side here.
Right.
T1, T2, T3, let's just say. Okay? Now, the scapula has a bursa that's underneath it.
Okay.
T5 was here is what we adjusted. These are compensating. T3 rib was also out, so it can push a little bit on that bursa and on that scapula.
Okay.
So it throws off what they call the scapular thoracic rhythm or the scapular humeral rhythm, which is the movement of the scapula along the rib cage. So that's what we did today. Okay?
Got it.
And the last thing I'm going to do, let's do the machine just to break up any of the scar tissue there. And then you can tell us again. Try it now. That should be very different.
Very different.
See?
Yeah.
Okay, let's check the shoulder. Let's set the left shoulder while we're at it. Over, around, down. There you go. So T5 is our culprit.
Okay.
It was just a little different combo. We did the left pelvis and the right sacrum, which is not typical, but that's what you presented with. Go ahead and do this one more time. Okay, now do it against resistance. Push up slowly. Hang. Pull down. Hang. Push out with your elbows. Pull in with your elbows. You need to work on those. Flies.
Flies.
Okay, stand up please. Squeeze. Squeeze. Hands are good, go on your back. And let's tune up the ankles. So a little different combo. Give it a couple of days.
Okay.
AS talus medial tilt. AS talus medial tilt.
So headaches were from the compensation of the C4 from the T5.
C4 was clear.
C4 was clear.
And on your x-ray, on the flexion x-ray, it shows that it does move.
Okay.
Okay, so we don't want to adjust compensation.
Got it.
Okay, walk it off one last time, please. And humor me one last time and do a squat. Didn't it?
Feels good. We're moving.
We're moving. Reverse bicycle
Yes.
for the knees.
And reverse walking.
5-10 minutes, please, with the walking.
Okay.
2, if you can even do 3 days without the weights,
Okay.
be better.
Sounds good.
And then can you just check in with me end of the week?
Yeah.
Let me know you did.
Thank you so much.
Welcome back.
Thank you. Happy
You're
New
welcome.
Year.
Happy New Year there. You take care.
You too.